Anybody who has mental health issues, they look down. They
Yeah.
don't give them opportunities in jobs, for marriages. Somebody who has mental health illness does not come to OPD telling me that if somebody sees me, what will happen?
And men are supposed to be strong, so they never seek help. Then another stigma about women, they have this like we have to do it all and we have to take care of everyone, so they don't seek help. Media, I always say, plays an important role. So some movies depict the mental illness and mental hospitals in such a bad state
Yeah.
that one gets scared to enter it, but it's not like that.
Women are guilty of being too tolerant to a lot of things in life,
Hmm.
and that should change.
Treatment is always it's combined with that, it's a jugalbandi of medicines and therapeutic conversation.
And these organizations need to be revamped in terms of not just thinking that what are the sales, what are the targets. We also need to look at the emotional wellness of the clients around. If we really talk to kids today, the number one problem is existential crisis.
Hmm.
Anyway, I have to die. Anyway, I'm living my life like this. Anyway, it is like this. So why should I live? 90% of our country is now either making reels or looking at reels at
Yes.
any given time.
So welcome, Dr. Pattojoshi and Dr. Sidhana to the About Her show. Generally, we get, women, trailblazing women on this show, to talk about the journey of their lives. And at times, we also get men because we believe that for a truly gender inclusive world, men and women need to be allies in this journey. Now, today marks a very, very special episode for two reasons. First of all, we are going to be having a conversation on the occasion of the World Mental Health Day. And the second thing is that we are going to be looking at this extremely critical topic from the lens of both men and women. So you're going to be telling us about what you think about this, how should I say, this issue, this which is, bothering and which is affecting all of us to such a large extent, and how men and women get to face this differently, deal with it differently, and more. So, once again, a very, very warm welcome to you.
Thank you.
All right, so let's get started. So, I'll start with you, Dr. Pattojoshi. And my first question to you is that as a neuropsychiatrist, how do you see the intersection of brain science and mental health shaping treatment today?
Yes, I think that's the most important debate that is going currently in our psychiatric circles.
Mm-hmm.
Where from a functional disorder, we are going more into a etiological basis.
Okay.
The number one is the diagnosis. Now, the whole, the the neurobiological things are helping us make diagnosis. They're actually creating better fields for targeted therapies now. Now we are looking more into a symptom-based treatment. We're not just labeling somebody as having a disease. We're now making sure that somebody has a set of symptoms and we are treating that set of symptoms.
Hmm.
We are also enhancing the understanding of the neurobiological underpinnings of diseases and disorders. Like we are able to tell to people that because you have dopamine excess, you have some glutamatergic dysfunction, you have certain issues in the hypothalamus. That is what is making you do this. So once there is an understanding of why some behavior is occurring, the treatment modality is improving. People are coming more for treatment. The stigma is reducing. People were telling that a lot of cultural underpinnings of diseases were there. That is being reduced. So coming, and then we are also looking at personalized medication. What works for Aninda might not work for me. So now we have a lot of genetic testings where we understand which treatment works, which treatment does not work, which drugs work in some person, which does not work in certain persons. So the whole gamut of the treatment from neuroplasticity, we look at why we should get in early. Why early treatment is important because the brain is, move. There are neurodevelopmental issues, the neurodegenerative disorders. We need to make sure how stress plays a role, why we should get in early, how a better environment helps. They also help in psychotherapeutic processes.
Okay.
Why so all in all, from diagnosis to treatment to prognosis to reducing the stigma to improve the health seeking behavior and to increase and improve the way people look at mental health, people with mental health issues.
Yeah.
All this, once there is a neurobiological basis to this, the whole things improve.
Right. So it is all very, very interconnected. And I think what I've understood is that in today's day and age, we are being able to understand the interaction and then working accordingly, right?
Yes.
Yeah. All right. So, Dr. Sadhana, my next question is to you. What drew you into the field of mental health, and how do you think your approach differs from a purely medicinal or psychiatric lens?
So yeah, definitely. Thank you, Sangeeta, first of all, for the show. And definitely, yeah, what drew me into the mental health was, I guess, my birth only, as I belong to the family of psychiatrists. It was decided. But later on, I got fascinated by it that human mind is so complex. It is the thing which is actually the emotions and the it is controlling our whole body, and it does not come with any rule book, any script, whatever textbooks you read, but every person is different. And
Right.
also, as Dr. Pattojoshi sir said, like these days neurobiological approaches are coming, but still I believe that mind and body are married to each other, and one suffers, the other sympathizes. So there is a biopsycho socio spiritual model which I used to look at, and maybe because of my life journey also, I have started looking at the deep root causes of the illness, like what is the main cause, what is the cause of suffering, what's happening, the mainly the psychosocial factors. So I
Okay.
go into that more now.
Hmm.
And that is like because mind, body, and sexual health and the family, psychosocial, everything is connected together, and even the spiritual. So that is like a sound body, sound mind, and a sound body. So
Right.
the holistic approach, I believe, that is more important. And at times, like sometimes the people don't need the medication even on talking, just the listening ear.
Hmm.
And when you go to the root cause, and the counseling sometimes helps, and the very low dose medication is needed. So that
Right.
is like, but that approach has changed with time, that with time people change it.
Of course, with time, I guess everything changes, and this is changing for the better. The recognition, the acceptance, and whatever, treatments are available, they're getting better by the day. So, both of you have worked extensively in this field, as I understand. But so you must also be aware of the stigma which is attached around, the topic of mental health. So, what kinds of stigma do you think people still encounter, and how does anyone or how does someone address them?
Yeah. Let me give a very interesting example, madam. Yesterday, I got a video from a puja pandal in Chhattisgarh, Bilaspur,
Hmm.
where where they have depicted a mental health hospital as the theme of the puja,
Okay.
where they have shown how people are kept in like prison like thing, where they have depicted typical stereotyped mental health people with mental health. They're showing them disabled, they're showing them to be aggressive, violent, being tied, a lot of negative connotations were there. And today, I managed to talk to the collector and the SP and the social, security people there, and we
Hmm.
managed to dismantle all these things. Within a couple of hours. We were able to manage to dismantle the whole structure of the way they have disintegrated mental health into a shamble. It was very pathetic. So
Hmm.
again, if you look at this, was the type of a structural, stigma.
Ah,
With
right.
the whole this was done by a railway people, and they've stigmatized mental health. They've shown in a very horrible light. Then
Hmm.
there is public stigma. A lot of people look at mental health people in a different. Anybody who has mental health issues, they look down. They
Yeah.
don't give them opportunities in jobs, for marriages.
Hmm.
And lot of, and then there is a lot of self stigma also,
Correct. Correct.
that I'm having an illness. So stigma comes with the diagnosis, stigma comes with the treatment. People think that anybody who has this illness, there's a naming to it.
Hmm.
People are not known by, suppose my name is Amrit and I'm having depression, or that depression person.
Hmm.
So there is a lot of also problems in terms of management, in terms of stigma related to health seeking behavior. Somebody who has mental health illness does not come to OPD telling me that if somebody sees me, what will happen?
Yeah. Right.
What will
Right.
happen to my public perception? A lot of negative attitudes towards people with mental illness, a lot of discrimination when it comes to people with mental illness, be it at home, be it office, be it jobs, anywhere. So and such and this ultimately leads to these people not taking treatment,
Hmm.
these people remaining isolated, the people having mental illness going down the ladder. And so
Correct.
it's a vicious cycle where one feeds off each other. The illness feeds on the stigma, and the stigma feeds on the illness.
Right, right. So,
And we have a lot of people who deteriorate. So stigma is the biggest challenge that we face every day. And yesterday was a prime example of how people, when they are worshipping goddess Durga,
hmm.
they've depicted people in the worst possible manner. They've made cells, they've made people tied down, they've made people to act. It's pathetic. It's uncalled for.
Yes, totally deplorable. I mean, in today's day and age, when you have so much of, awareness, so much of knowledge, so much of exposure, if you can do it today, then, I mean, I shudder to think what would be the scenario maybe 5 years, 10 years ago. So, Dr.
But
Sidhana,
at least the authorities were good enough, strong enough to take action immediately the moment we contacted them, and they were good enough to send us videos of dismantling of the whole structure of what they had done, madam.
right, right. So, Dr. Sidhana, would you like to add something to this?
Yeah, definitely. First of all, today, actually, I was about to forward you the video what Dr. Pattojoshi sir has done as an Indian Psychiatry Society secretary. It has been an example for the younger generations, and he's actually changing the definition of psychiatry only, like raising the bar of mental health high. And that video I will be sharing with you, like how these boards were removed and such a prompt action within a day it has been taken, which has
Right.
not been done in the past, first of all. And definitely stigma, as sir said, it is like a self stigma is more, that is dar hamara ko, it is a self stigma, I am weak. For men it is like a sign of weakness, personal weakness, that is a culture dependent, and men are supposed to be strong, so they never seek help. Then another stigma about women, they have this like we have to do it all and we have to take care of everyone, so they don't seek help, like we are the caregivers first. So that's the difference between men and women. And then the stigma which comes among the society, marriage, many people hide the stigma, mental illness, and don't get married also, even like rather spouse can be a biggest support system during the marriage. And then there are many movies, media I always say plays an important role. So some movies depict the mental illness and mental hospitals in such a bad state
Yeah.
that one gets scared to enter it, but it's not like that. We have worked at the mental hospitals, and though we don't even call them now mental, but we call them persons with mental illness or the clients. So definitely that state which is shown in the movies, which is very pathetic, that has to be changed by the media. And stigma is also, other than that, everyone says like if you start medication of psychiatry it will be lifelong. So
Hmm.
anyways, if you take thyroid medication, diabetes medication, that is also lifelong for many people.
Hmm.
So, and you are not crazy if you are seeking help. I myself had stigma going to my father's hospital. If I had to take a rickshaw or something, I will say like some neighbor's hospital name, because my father is famous as Pagalboka hospital doctor. So I will be ashamed like how to go to that hospital. Like people will think I'm going to take psychiatric treatment. So
Right.
that is the stigma prevalent, and people pay lakhs of amounts of money in Mehndipur Balaji. You can go and see in then Bilaspur example sir gave. So stigma has to be removed at the societal level, and sir has taken the first step. And that video I will definitely share with you, and you can put it that, because you have that Anhari also mental health setup, and she's a very big mental health advocate, sir. And
I
so,
know.
yeah, definitely
Thank
I
you,
was
thank
just
you for doing
about to
your
share
work
it, and
for
then I
mental
thought I
health.
will share it after it.
No, no,
I
no.
guess all of us
I've
have.
come to, I have come to the talk. I have researched her also. Don't worry.
Okay.
Yeah. So we were talking about, like you mentioned, the difference between how men and women, experience the stigma. Even, I mean, self stigma is important, but even I guess the way men and women are stigmatized, there could be differences there as well. So when people are seeking support for mental health, do you think there is a difference in the way men get it or women get it, or you think there's not much of a difference?
Question to Aninda or me?
Both of you, you can go first, sir.
So first, let me answer, then let Aninda add.
Yeah.
My personal experience is, women, till the woman doesn't become dysfunctional to the family, he or she is never brought to the hospital.
Right. Hmm.
People don't care if she's suffering or she's not suffering.
Hmm.
Most of the times,
I agree.
as long as the family is not affected, the husband is not affected, the children are not affected, as long as she's speaking normal, she is made to be felt that she is normal. So
Hmm.
somewhere the health seeking behavior when it comes to women is much less. And when they come, it is very severe.
Yeah.
Even I'll just talk about two simple things, and the most of the women suffer from. One is a premenstrual dysphoria. You
Hmm.
know, it's so common and that's so distressing. I see a lot of female talking to me about it. She
Hmm.
said 5 days, 7 days before that, I feel irritable, I feel bloated, I don't feel good, I don't feel, you know. And if the male does not feel good for a day, he or she will sleep in the bed and not get up.
Yeah.
I think women are guilty of being too tolerant to a lot of things in life,
Hmm.
and
Hmm.
that should change.
Yeah.
And the number two is postpartum depression, postpartum psychosis. Again, that those are very, very important issues, which I think every gynecologist, because they won't come to us, because there's a lot of stigma around people coming to us. But if the gynecologists or the obstetricians would take care a little of these things, I always feel that it's not that we should treat everybody. Everybody should be treated. Every person who needs treatment needs to be treated. It's not that everybody Amrit will treat or Aninda will treat. Even if an obstetrician is able to take care of maybe how to prescribe something for somebody who is suffering from all these things, and it's recurrent, and people are not much distressed by the periods or the menstrual cycle. It is the premenstrual dysphoria that is taking a
Hmm.
lot of toll on the woman,
Hmm.
and postpartum depression, and then rest all Aninda can add. But I think as long as we don't understand, we don't have that EQ or to understand if my lady, be it my mother, be it my wife, be it my girlfriend, be it my daughter is suffering,
Hmm.
I can't be good enough.
Yes. Yes. That EQ has to be very high.
So let Aninda add. Aninda wanted to speak, so I thought that I'll
Yes.
just
I
speak on two
can
things,
add a
which I
lot.
think.
Yeah,
Yes.
definitely. Uh, First of all, my thesis was this only stigma and help-seeking behavior. It was in the South India, in which we saw that women take much longer time to reach the hospital despite having the symptoms because they are not the breadwinners. And till then, they are earning the money, they are not being cared of, first of all. Then, as a woman, as sir said, like a man will sleep in a bed for a day. So, few days back only, I saw a post on Facebook. A man, a woman who has undergone delivery without anesthesia can only understand the pain of a man who is suffering from a cold. So that is the society, that is the state, like men actually don't understand. And a woman, when she says she's sad, she is dismissed as she must be dramatic, especially the premenstrual symptoms. And as a woman, one does not know whether she is hormonally sad, whether she is seasonally sad, or situationally sad. So
Hmm.
premenstrual dysphoric disorder is for real, and it can cause suicidal ideas also. So it
Right.
has to be taken very seriously. And about postpartum depression, everyone is ready to hold the baby, but nobody holds the mom. Who holds the mom? Everyone is very excited, baby, baby, baby. And what about the mom? There are so many hormonal changes, so many emotional changes, then bodily changes happen. Libido changes, relationship, marital problems, everything comes up with that. So for that, then stigma with women, everything is dismissed, even like in earlier times also, that hysteria, that was like a wandering womb uterus. It is word has only come from that,
Hmm.
because a female, whenever she complains of it, she is having headache or something, it has been dismissed, which like even it's like she has been told no, she must be dramatizing, it's okay, ye to
Yeah.
chalta hai. So that is not the case, because women are more prone to having these mood symptoms because hormones are play an important role in our body.
Right. Right.
But
Right.
nobody understands that the 28 days cycle is also uh, is like one day you are at the top of the world, next day you are crying, but
Correct.
no one can understand that. So for that, anyways, I introduced to you the Heal Cycle app, in which we can
Yes.
track the mood symptoms and the journaling and all, which is important.
Hmm.
Postpartum depression. And also men also, they don't seek help because of the stoicism which has been prevalent, that men are supposed to go to the war and they are supposed to be strong. But embracing your vulnerability is strength. And the interview of Shah Rukh Khan, which you have seen, he has been so vulnerable while talking about his sister suffering from schizophrenia and his father's death. It doesn't mean he's weak. He is, anyways, the most gentleman. So, embracing your vulnerability, and vulnerability is a sign of strength, and men can cry. Once we start changing this, things will change, and society, like, even I don't say that men don't suffer from mental health issues. They suffer more because they keep emotions bottled up.
Right.
They never go out to friends and talk about their personal issues. We went out and we get relieved.
Hmm.
And also women meet, they hug, and all the oxytocin and all those things happen. But with men, it is usually like superficial talks or jokes, which is because they feel talking about emotions will be depicting them as a weak man.
Right,
So
right.
that has to be changed definitely. So this masculinity definition and the women being dramatic has to be changed. So things will change, and emotional regulation definitely is important here.
Yes, you're right. So I think, this all stems from what has been fed to us, what we've been believing all these, centuries, years, and it is the result of that. So we need to change the narrative around that men always have to be strong and women are always, you know, overacting or dramatizing. It's not that. We have to dig deep and understand the issue and make it okay to express themselves or make it okay to talk about what they are suffering from, mental, physical, whatever it may be. Okay. So, Dr. Pattojoshi, my next question is to you. So, can you share how advances in psychiatry, like medication, neuroimaging, brain stimulation, all these are changing the various treatment options that are available?
First of all, let us go to the neuro. Let's look at testing
Right.
so now we have a lot of genetic testings that are coming on now.
Okay.
Like when a patient comes to me, I based on my what I've studied and most of the things which we have fed are all Western data.
Hmm.
Indians look at a lot of patients, but they don't publish. Western people don't look at a lot of patients and they publish. So
Hmm.
we are guided by what we have learned during our PG days, and most of the textbooks are Western books. So the data is Western, the medication is Western. It's whole a different. So now when we give a medication to somebody, it's more of based on the experiences, based on what we have read, and based on the safety profile and all. And it's more of a hit and miss.
Hmm.
We
Hmm.
can't definitely tell that this medicine will work. Sometimes we might lose somebody. Sometimes somebody's productivity might go for 2 to 3 months. Sometimes we might term somebody as resistant when we have not even given him the right medication.
Correct. Correct.
You understand? Like your son is very good in long jump, and you're
Hmm.
telling him to run a sprint and is not doing well. So you tell him that you are a failure.
Hmm. Hmm. Hmm.
So the
Right.
same thing is happening in our field. So now we have genetic testing, which tells us which medications work the best in a patient. Like
Right.
somebody can afford, like it's a test worth 10 to 15,000 rupees only. Now
Hmm.
for me, every day is worth 5,000 rupees. Suppose.
Hmm.
So in 3 days of my earning, I can know which medication will work, and I come back to my feet as soon as possible. That saves a lot of money.
Correct.
So treatment. Then there are a lot of medications, new medications on the block.
Hmm.
Be it esketamine, be it like there is a drug called primavaserine, there is lumateperone, the long-acting drugs, which if you give every 3 months, every 6 months one injection, the patient need not buy medications, take medications. Just there's lack of stigma, there's less stigma, there's less side effects. So a lot of new drugs are coming.
Hmm.
Neuromodulation. If you look at neuromodulation, that is improving by leaps and bounds. If you look at the coils that are coming, if you look at the way it is improving, and for OCD and for depression, neuromodulation is doing a lot of wonders. So, and the third thing is neuroimaging, be it fMRI,
Hmm.
be it DTI scan, be it PET scan. A lot of molecular studies are coming now. They're all helping us to understand illnesses better. And 10 years back, 15 years back, we were not able to tell anything to our patient. We're telling this is a disease because you have this hormone. Now we're able to tell him on the screen, we're able to show him this is the dysfunction in your this area. And this area is responsible for your impulsivity.
Hmm.
So when you get angry, you're not able to control it anymore.
Right.
That's why you're losing it.
Hmm.
This is the reason why you are repeatedly washing your hand. This is the reason why you're hearing sounds. This is the reason why you are visualizing things.
Right.
This is the reason, and we are able to show them because it was speculative. 10 years, 15 years back, it was speculative. So anybody can discount it.
Hmm.
That it was one's opinion against another. But once there are investigations, once there are things in black and white, once it is documented. Now, I'll tell you a simple example. Now, people catch somebody who is taking alcohol by a breath analyzer test.
Right.
But many of the accidents are being done by people who are high on cannabis or high on opioids.
Hmm.
And there's no test for them.
Hmm.
Even if a father comes to me telling my son is taking drugs, the son tells, no, I don't take. So
Hmm.
it's one's words against that. But there are tests now. We just test the urine, we know what substance the person is taking. So once I show the evidence to the child or
Hmm.
the person, he keeps quiet. He tells
Correct.
me, मैं 15 दिन पहले लिया था, मैं
Hmm.
बीच बीच में लेता हूँ. So again, there is a reconciliation to the fact. Yes. So evidence-based medicine is now important. Medicines have become personalized. Now we are able to treat a disease based on the symptoms, based on which drugs will work, what are the genetic composition of the man, which drug might cause a reaction which might be a little problematic. So we are
Mm.
able to get a lot of things. We are able to understand what are the connectomes, how they are connected, how they're responsible, and we can also predict what might happen with this disease.
Right.
We cannot just stereotype people with having schizophrenia, affective disorder, OCD. Now we see a lot of people who there are a lot of comorbidities now. Now we
Mm.
don't have to make five diagnoses. Now we can tell this is a set of symptoms where somebody is little abusive, aggressive, is taking alcohol, is
Mm.
doing this. We know, yes, this is how we go about it. Because
Mm.
somebody will tell that today you had told me schizophrenia, after 2 years, you're telling me I'm having affective symptoms, I'm having OCD. And then there is a lot of confusions, a lot of negativity regarding our diagnosis, regarding our management, but it's all fluid. It's moving around. So I
Mm.
think somewhere the recent trends in the neuroimaging, be it fMRI or DTI scans or MRI, be it genetic testing, be it the newer molecules, are making medications more personalized now. We have a drug for hallucinations in Parkinsonism. Now, we always thought that hallucinations is due to psychosis. This is the drug which we should give. But now, for a specific thing, we have a specific drug. For negative symptoms of schizophrenia, we have certain drugs. So before we had drugs for schizophrenia, now we have for negative symptoms of schizophrenia. Then for negative symptoms, one of the symptoms, this works well. Now I have a drug which works very well for hallucinations. Somebody has a drug. So somewhere we are able to give better results. And once we are able to give better results, the stigma around mental illness reduces, the health seeking behavior improves, and we have a better outcome, better prognosis of people who are suffering from serious mental illness, themselves, or SMDs.
Okay. So clearly, one can see that there is a lot of advancement that has happened in this space. And at least as far as the treatments, like you're saying, they're personalized, they can be customized to people and their specific issues. So that obviously, speaks very well about the advancement and, how far we have reached. So that is, of course, very, very encouraging. But along with this, what I understand as a layperson is that yes, you do need the treatments and you do need the medication, but you also need a ear, somebody who can talk to you, somebody who can listen to you. So, how should I say, a sympathetic ear is also equally important. So, Ananda, my question is to you that how do therapeutic conversations and counseling complement this psychiatric treatment in helping patients heal holistically?
So definitely, even search treatment is always it's combined with that. It's a jugalbandi of medicines and therapeutic conversation
Right.
because you asked him about the medication. That's why he answered that. Otherwise, he anyways he's the most empathetic psychiatrist and he listens to it. And I think medicines come down dose of
Hmm,
medication.
hmm, hmm.
And yes, the therapeutic conversation, that the sympathetic ear, more than that sympathetic, I would like to use empathetic ear. A
Oh,
listening ear, empathetic ear can turn a life around. On that basis, only many helplines, suicidal helplines, then telemanners, online mental health setups, they are working.
right.
That because at the time of emergency, if someone listens to you, that is enough. And also, along with that, the therapeutic conversation, they help you in understanding that cognitive behavior therapy and therapeutic conversation is very important as they help you in providing a safe space, a confidential safe space people need at times. And also they help you in organizing and recognizing your own negative patterns and developing the life skill sets which you can which can help you in later. And
Right.
journaling has come these days in which we can recognize our own patterns.
Hmm,
So as my favorite quote, another quote is like what mental health needs is more of sunlight, candor, and unashamed conversations. So
hmm.
unashamed conversations, talking about mental health is very important, and therapeutic conversation. And also this high, there are high fidelity CBT skills, then brief therapies, they give the person the sense of empowerment that yes, I can manage my own life skills with the skill training.
Hmm.
But obviously medications are also very important, and the advances which are told about, they play a very important role these days, of course. That first of all, there is a like a not a variation in the diagnosis, also people can test, and testing is important. Then personalized medicine can also help in identifying the side effects. Someone might be having some side effects to the some
Hmm.
medication, but so that is important. And many in many cases medications don't work and neuromodulation has to be used. So definitely it is like a jugalbandi, nobody like full film script, all the things are
Yes.
together.
So we've spoken about the advancements which have taken place in the field of medicine. And then, of course, we've also spoken about how it has come to be recognized that conversations, listening, empathy, all these things are there, which, exist, and people can take the benefit of this. But still, what we see around is that many people, they still hesitate to see a psychiatrist or a therapist. So on this, such a, how should I say, a significant, important day for mental health, what misconceptions around this would you like to clear today? So, Dr. Pattojoshi, if you could go first.
Now, if you look at misconceptions, there are a lot of misconceptions about mental health. Number
Right.
one is people think that mental illness is a sign of weakness. So
Hmm.
whenever somebody talks to anybody, they tell, "Arey, you do this, you do that." Many of them tribalize mental health,
Hmm.
telling that change your diet, sleep well, do meditation. Children are suicidal, children are talking about depression, people are talking about their sexual abuses that have happened to them, post-traumatic stress disorders for following that, and people that just divert your mind.
Hmm.
Tribalizing mental health is a big thing that we cannot tribalize mental health. Like Aninda was talking a lot about spirituality and all. I think I'll just Aninda might mind me telling this, but
No.
when people come to us, they don't come to us with tribal mental illnesses. They come when things are little higher because when people try to fight it out, and when they are not able to do it, they come to us. So I always tell when you are very hungry, you cannot fill your stomach with achar and papad. You
Hmm.
need your roti, you need your dal, you need your sabji, you need your achar and your papad. So spirituality, meditation, exercise, all help. And I think for primary prevention, it is very good that you need a good healthy lifestyle. You keep out, do exercise, do meditation, be a little spiritual. I think all those helps. All those are very important aspects. But many of the times we have to give medications to people. There's a lot of stigma around medications.
Hmm.
And why this stigma is there? I'll just give you a very small example. Like somebody comes to a Dr. Pattojoshi and takes a prescription. And then he comes for follow-up and then he takes, because he's doing good, I continue the same medication for another 1 month.
Hmm.
But suddenly the patient thinks, why should I pay 500 rupees to Dr. Pattojoshi and spend 300 rupees on an auto and spend 2 hours waiting for it and spend 30 minutes in the morning calling up? The site pharmacist tells him, you take the medications from here. So
Right.
now he starts taking medication because I've told him that this illness needs 8 to 9 months of treatment. He thought that I'll take medications for 8 to 9 months and he continues with the same medications for 8 to 9 months. And then suddenly he feels that Dr. Pattojoshi had told it's only for 8 months, let me stop my medications. The moment he stops his medications, he's not able to sleep. He feels restless. He feels a little aggressive. He is not feeling the same as he was. And sometimes when you leave a medication acutely, you have more anxiety symptoms than the actual disease had
Hmm.
for
Hmm.
a couple of days. And then the patient thinks that now I have to take medication lifelong. So he or she takes medication lifelong. But it's not so because I'll tell you, when you make a house, the amount of cement and sand that goes for the foundation, the amount of cement and sand that goes for the walls, and the amount of sand and cement that goes for the ceiling are different. So when a patient comes here to us in an acute phase, what treatment we give, then how we maintain it and how we taper it off, it's a skill.
Yes. 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 Yes.
Anybody can put you inside the chakra view, but taking him out safely is our work. And
Yes.
because of that, there's a lot of stigma. People take medication, they can't leave, and they think that any psychiatric treatment is lifelong.
Yeah. Yeah.
Any
Yeah.
psychiatric treatment is lifelong. It's not so.
Hmm. Hmm.
Like an analogy of what Aninda tells of thyroid or a blood pressure or a diabetes is very good. But I tell you, 90% of the diseases don't require lifelong treatment.
Hmm. Hmm. Hmm.
Yes. Many of the diseases, they come for anxiety, they come for panic, they come for an exam, a lot of things. So everything you need not give them lifelong. So that
Yeah.
is a big stigma around things. Next is stigma around safety with a psychiatric patient around you.
Hmm. Hmm.
People think that all psychiatric patients are violent. I think more normal people are more violent than psychiatric
Yeah.
patients are.
Hmm. Hmm. Hmm.
If you really look at what is happening around the world, every day we are seeing on TV
Yeah.
what is
Yeah.
happening.
Yeah. Yeah. I totally agree.
How many people are diagnosed with having primary psychiatric illnesses?
Hmm. Hmm.
Another misconception about suicide is if you talk about suicide, the other person will do. You're inducing suicide in somebody. It's not so because the best way to manage suicide is conversation. Because people want to express, nobody wants to die. Everybody wants to live. They
Yeah.
feel there is no other alternative to their hardships, what they're feeling. You need to create conversations. What Aninda was telling, you need to create those pieces where people can talk, people can vent out and get solutions. If you don't talk to me, how will I tell you that yes, if you have failed in your sixth class, it doesn't mean that you should die.
Yeah.
It means that you more. It means that you should focus more. It means that you need to take care of yourself in a better manner in terms of academics.
Hmm.
The next thing is about addiction. Again, if you look at substance abuse, the
Hmm.
stigma, the misconception about something, it's people tell that it's a character flaw. I tell you, it's a genetic thing.
Hmm.
Why? Why in the same environment, this man is taking alcohol and the other man is it's genetic makeup. It
Hmm.
is how, what are the childhood experiences? What is the coping mechanism? A lot of factors. Nobody wants to, somebody knows that he has cirrhosis and is going to die and still he takes alcohol.
Hmm. Yeah. Yeah. Yeah.
So it's beyond, your control. There are things beyond your, you know, morality. So people tell addiction as a morality. That's a misconception. I tell it's not. It's another disease. Once you look at a disease model, and that's why most of the rehabilitation centers, they make it, you know, they don't make it medical managed. Don't tell it it's a diagnosis. They call it a character flaw, and
Yeah.
they don't give medications. And it's a disease. You need to treat with medications. Along with it, therapy. Whatever goes with it.
Right.
But
Right.
somebody is having opioid, if somebody is taking alcohol, if you don't give him medication that reduces craving or his withdrawal, then he's going to relapse.
Yeah. Yeah.
And we call it that this man is character. This guy is weak. He's not able to morally. He's not, and that's unfair. So somewhere these are the basic misconceptions we hear, and there are a lot of other misconceptions. I think this is good enough.
Yes, because these are like, very, very glaring because things like that, it's going to be lifelong, or things like that, it's a flaw in your character. So all these are very, very common, you just see. And I think this is primarily one of the reasons why people don't seek help because they just believe in all this. So, Aninda, would you like to add something?
Yeah. So first of all, definitely it is, as sir said, it's a flaw in your character. It's not a flaw. That is a mental illness or any illness. It is a play of nature and nurture. Genetics play an important role,
Yeah.
but still nurture that there are adverse life experiences, and everybody goes through the life experience, life events, and it's not necessary like when someone has a stress, they will undergo the lifelong depression. It's like time-based management is important, and until the socio-occupational dysfunction is happening, that is also one has to see. And to explain it to people, it's very important to explain them like, as mind is a software and brain is a hardware. So similarly, the brain has a lot of wires and chemicals which are controlling our mind, and mind in turn controls the thoughts, emotions, behavior, and judgment. So we have to, the medications are there to treat those electrical combinations or the chemical changes. Similarly, the as in diabetes, the insulin chemical changes, they are treated. So
Hmm.
these are also similar to medical illness. And as again, I will come back to SRK, as he said in Dear Zindagi, that obviously when we have the mental illness, we never call anybody, any relative. If they come to know also, we are like, oh no, why should you? उसको क्यों बता दिया depression है? Why did you tell? Why did you tell like she's having depression?
Yeah.
But if I get fracture, I will get very angry if one friend does not come to meet me. Why?
Hmm.
My brain is also a part of body, and that needs more support. At that time we need more support. And I believe like in healing journey, in the depression, in the healing part, the support system, strong social support system, it helps a lot as compared to other illnesses. So
Yes.
there should not be any shame or stigma. And these alcoholism, these all are illnesses, they are not the character flaw, first of all.
Yeah.
And going to a psychiatrist does not mean that you are a crazy person or you are mad. So first of all, that even the Indian Psychiatric Society had taken a stand when one movie had come about Kangna Ranaut, that judgmental hai kya.
Hmm.
So it was like mental hai kya, it should not be
Yeah. Yeah.
the word only should not be used, the mental.
Right.
And so there are a lot of misconceptions, and so media can play an important role, and these conversations play an important role, and psychoeducation should start from the beginning. And even all the schools should have this education about emotional regulation, because emotional regulation, adverse life experiences, coping mechanism, they all help in maintaining a mental wellness. So it's time to talk about mental wellness and remove the stigma. So
Absolutely. Absolutely. Very well said. So tell me, you touched upon the role of societies and communities. So now in the world in which we're living, there's stress is rising all the time, especially at the workplaces and personal lives as well. So in such a scenario, what role should organizations and communities play in safeguarding mental health?
If you look at organizations, because I have worked in one or two big, IT organizations where I just joined to understand the how the mind of the IT people work.
Hmm, hmm.
Because I was moving to a city and I thought that let me learn. If you don't learn from the dust, you will not learn anything. So
Right.
I went and I learned a lesson in my life that I would go to these young engineers who would have a lot of issues, be it workplace. Now, be it personal issues, yes, I was able to do. But when it came to organizational issues, I was not able to do.
Hmm,
Why
hmm.
was I not able to do? Suppose I tell that this boss is harassing somebody
Yeah.
in a very significant manner. The top people would tell, no, we can't do anything about it. When
Hmm,
it continued for a few months, I resigned and came. I told, if I'm not an agony aunt that I'll hear problems.
hmm.
I'm a man who gives solutions to people. And I felt like my hands were tied.
Hmm.
And when I can't suggest anything, I'm just going there to listen to people and they will be disappointed in me. Because if you're coming and giving me 30 minutes, you also want something out of that. Time is very precious, time is valuable. And let venting out the emotions and not getting out anything. It's also a very painful experience.
Right, right.
When you have expectations when you go to somebody and then you talk about because it's not easy to open up in front of a lot
Yeah.
of people.
Hmm,
A lot of
hmm.
people open up once or twice and they feel disappointed and they never trust anybody with a problem. So these organizations need to be revamped in terms of not just thinking that what are the sales, what are the targets. We also need to look at the emotional wellness of the clients around.
Hmm.
And that's what I do in my workplace. I make sure that everybody is happy.
Right.
If there's a festival and there is a lady who is married and she needs to be at home, I tell please be at home.
Hmm, hmm,
There's
hmm.
something to be done, please go back at 5 o'clock because you're married and you stay with your in-laws. There's
Right.
something you need to take care. If somebody is pregnant, you need to take
Yeah.
care, give her a separate room where she can rest for 2 hours. We cannot have the same set of expectations from everybody. What I
Absolutely.
expect from the what I expect from X will be different.
Yeah. Yeah.
It cannot be same. They will be similar, but they cannot be same. So somewhere the workplace has to be tailored made based on individuals.
Hmm,
We
hmm.
cannot have one size fits all. That does not work. Because if you have 100 hands, it's as efficient as it is, and there is no leg, you cannot walk.
Yeah. 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 Definitely.
Baahar de dunga. So organizations need to change the way because I see a lot of people now, the young generation, are taking a break from work.
Yeah. Yeah. Yeah.
I have never taken a day off as break.
Hmm, hmm.
These people are so they have everything. They go on foreign trips every 3 months. They have everything. They buy big cars, they have houses. I don't have a house. They have everything. They're not happy. They want to take a break. They don't want to work. But if somewhere it needs to be changed. The stigma around mental health needs to be reduced. There are a lot of people who are suffering now. Communications and connectedness has to be increased and improved.
Yeah. Yeah.
That's
Yeah.
the work of the communities. We need to improve the connectedness. Dandiya night does not mean who wears the best dress.
Yeah. Yeah.
There are a lot of
Definitely.
things again.
There is just tonight, I'm sure.
Dandiya night is not about how to make a good video and put it. Make a video that is second. That should not be the primary
Hmm,
event. That's what is happening to our generation. Access to mental professionals has to improve.
hmm, hmm.
Nobody has to be discriminated based on whether he or she has taken help of a mental health professional. I think many times we take the help of mental health professionals to improve our efficiency, to be better. There has to be few people in the organizations who become advocates for policy changes in the
Yes.
organization.
Yes.
There
Yes.
has to be policy changes. LGBTQ people need to be adjusted.
Hmm,
Now, a significant percentage of people are the LGBT. They're
hmm,
not visible because you won't. But I'll tell you, go to a supermarket where 30 people are working. 5 people will be females who have cut their hair short.
hmm, hmm, hmm.
Look at security guards. Look at a lot of people. Now you need to open your brain to see what is happening now.
Yes. Yes. Yes.
And which washroom are they using? You go and see. That is the stress for them.
Hmm. Yes. Very true. Very true. Pointed out
Where
some
they are made to stay.
important
The
things.
poor people, they're made to stay. I feel I'm a female and I'm made to stay with a male because I have all the character. These are small things. You might think these are small things, but these are very, very big things for somebody who's suffering.
Yes, yes, absolutely, absolutely.
Treatment seeking behaviors has to improve. If somebody has psychiatric issues and are medications, let us not give him night shift.
Hmm.
Let him work 1 hour more during the daytime. Let him work on holidays, but let us not give him night shift. So
Yeah,
somewhere, and in the community, in the schools, we need to work on resilience of our children. We need to work on the coping skills of people. We need to be supportive of others. We need to
yeah,
be the framework on which people can lean on when they have issues. We
yeah,
should not be people who are, for us, every new thing is a news to be told to somebody else.
yeah, yeah,
Let's be the person where it stops, the news stops,
yeah.
and a solution comes out of the news. I think we need to change ourselves in the community, in the organization.
So I think the bottom line is that you need to recognize that people are different and you cannot paint everybody with the same brush. That I think is
And
first.
and and you cannot tell what is stress for him. He's taking the stress, and you cannot tell. Everybody is different.
Yes,
Everybody needs to be treated differently. That's it.
absolutely, absolutely. So Ananda, in this context, can you add what families should be doing? See, in India, we are very, very family centric. Our family bonds are very strong. So
First of all,
I want you to tell me about what role families can play when these kind of situations arise.
so first of all, about the organization, sir is heading the organization of Indian Psychiatric Society, and actually he's taking care of everybody's mental health.
Hmm.
He actually listens to everyone, whoever has, like, for me, he has been a biggest support system. Not only me, many young generation or anybody. Like if someone has a problem, he listens to it and tailors the job according to it, the work hours and all. So that is the empathetic thing which should be there in a leader. The leader should lead with empathy, clarity, and courage. Like, so that is like organizational psychology. So that sir is anyways implementing and definitely is going to other places. And about the organizations, I always say, like, people also should not get so busy in making a living that they forget to live a life.
Yeah.
And the organizations are these days being like a pressure cooker, like a burnout place, which should not be like that. And I believe, like, work instead of work life balance, work life balance is best. Travel, vacate, travel, and work. So that is the thing. And mental wellness is important. Yeah, definitely. India has a very big advantage of a good social support system in role of families,
Hmm.
because that is not there in Western culture.
Yeah.
But in our culture we have a very close knit families, and there are people in families, they come to you, come whenever you have a problem, they are there standing to listen to you, to help you out. And strong family support system is very important. Not only the family, even the friends. I
Yeah.
say, like, at times blood, it's not true that blood is thicker than water. Many times friends are more supportive than the family. So having a good network and nurture and support system is very important, because they are the people who understand you. They don't judge you. They listen to your problem and they guide you also. A good friend or a good family member is the one, like a, who does not leave you like a shadow, but also is like a mirror who can show you your weakness
Yeah.
and tell you on your face that this is the problem with you, and go. So I have been very lucky to have mentor like, yes sir, and everyone, like, even so. And like emotional uh intelligence and empathetic emotional regulation, naming the feelings, that should be taught to the children, to the kids from the beginning. And I always say parents should be first friends to the children, then the parents, then only things can change, because then only children will come and tell they are scared of something or something is hiding in them, and they should start naming the feelings. They will help. It will be interactive.
Yeah.
And the digital media is raising the children these days, so parents can control it, but not to full level. Obviously, even parents are only addicted to screens these days,
Hmm.
but still some control should be there. But the more stricter you are, the things become like rebellious. So definitely be a friend to a child so that they become comfortable and share with you. And in the family, there is, yeah, family time is very important. The quality time of the family, that, like, even COVID lockdown, they, that actually brought us close to our families, that we all started eating together. And like in my family anyways, like how much busy my father has been, the one rule is there, like we all have a dinner together,
Hmm.
whatever happens. Yeah. So because that is the quality time, and about talking to each other, and also go on a drive like at the evening. So talking to your children and being frank with which I have learnt in the family culture. And even the joint family system was very supportive earlier. Nowadays we have become nuclear families and children don't learn much about the social connectedness, but we should tell them about the interconnectedness, to talk to the family members. Or even if you are going away, older elderly people suffer from emptiness syndrome, but if you just give them a one phone call, how are you feeling papa, that will be very good for them.
Yeah, yeah.
So that emotional connectedness is very important, and this family support is definitely much important and very big leverage, I say, in a Indian culture as compared to the Western culture.
Yeah.
So that is definitely very important.
Very true. We have this very big advantage as compared to the other cultures, and like you said, everything in moderation. Expose children to technology,
Yeah.
do all of that, but everything has to be moderated. Just cannot kind of fall into that trap. So tell me, when you look at the younger generation today, especially the Gen Z, now we see that, while everybody is criticizing them and is talking about all the things that they are not doing, but what I believe is that they are also under a lot of pressure, because they are living in a world which we as parents probably have no clue of, but we still like to sit there and lecture and judge and tell them that this is not right and that is not right, or we didn't do it because we didn't have it. So my question is that, what are the biggest mental health challenges you see in the younger generation today?
So again, I'll tell you, I just had a female who had come, a young girl, 15 years old, and she told me that my interactions with their parents are all negative.
Okay.
If I talk to them, if any problem, they told, why are you using Insta for so long?
Hmm.
Where
If
are
I
you
tell
using?
them from Instagram.
Okay, okay.
So if I tell them something about my school, they told, why do you wake up so late?
Hmm. Hmm.
They tell that my problem is somewhere, and they immediately accuse me of something, which it's okay. That is not linked to the problem that I face. Somewhere the parents, we all as a parents need to reorganize our thought processes, that they cannot be like us. Our parents thought that we have to be like them, and they would do parenting in a way, I think, where our brains were, you know, taking all those things. But these kids, the current generation, the Gen Z, the
Hmm.
brain is not like that. And let us be honest, it's not that they're doing it because they have to do it. It's because it comes natural to them. The whole, and if you look at Gen Z, the biggest worry is their mental health.
Yeah, yeah, yeah.
The number one issue the Gen Z are very, very careful about is their mental health.
Hmm.
That's why we see a lot of people talking about stress, with this talk about depression. A lot of youngsters are talking about existential crisis. Why should I exist?
Hmm. 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 Hmm.
If you really talk to kids today, the number one problem I see is existential crisis.
Hmm.
Anyway, I have to die. Anyway, I'm living my life like this. Anyway, it is like this. So why should I live?
Hmm. 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 Hmm.
Because they've not been taught to live for others.
Yes, yes.
The generation overdid for everybody else. So they taught the other generation they don't do anything for anybody.
Hmm. Hmm. Hmm.
There was no moderation in the way they had done and the way they have taught. So I
Yeah.
think everybody, even I tell to people, if you're feeling suicidal, if you're feeling very down, just adopt a pet. Then you start living for somebody. Then you know that if you don't come back on time, the
Hmm.
puppy won't leave.
Hmm.
If you think that something is going to happen, I have to come back because there's somebody who is dependent on me.
Yeah, 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 yeah. Hmm.
A mother, in spite of all the problems she has, never thinks of ending her life because she knows that if something happens to her, two of the kids won't be able to get food.
Yeah.
So if somebody thinks of doing something, you think that what will happen to these two children. So somewhere this is one aspect, and but the most important aspect, and I think the Gen Z will resist what I tell, but it is mobiles, social media. That's the 90% of our country is now either making reels or looking at reels at
Yes.
any given time. So
Right.
productivity is at an all-time low.
Yeah, yeah, yeah. True, true.
People are consuming information through reels. I ask people, where did you get this information? I saw a reel.
Hmm. Hmm.
And
Hmm.
the authenticity, who made what, why he made that, what he's telling. We are looking at people, we are not looking at people who are public influencers.
Hmm.
Influencers tell us what a lot of nonsense and people believe it.
Yeah, yeah. Correct,
I
correct.
think people believe what they want to believe at the end of the day.
Hmm.
So the role of social media in shaping how kids are thinking, how they're reacting, how they are behaving has to be reduced.
Yeah, yeah, yeah.
I blame the teachers a lot for this. Post COVID, why should every instruction come through via mobile?
Hmm, 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 hmm.
Why do the parents tell me that no, we are connected to the school through mobiles?
Right.
Before 2020, were not people studying? Were not people understanding what is happening?
Yeah, yeah, very true, very true.
Now, what a kid is doing on the mobile, nobody knows.
No, no, no.
You can't know, I can't know
Yeah,
how
yeah,
very intelligent you will be. So, social media again, reels, how they're capturing our kids, how they're capturing their brains, how they're making them dependent, how the dopamine burst is required every 2 minutes, 3 minutes, 1 minute. Now we have serials which come for 1.5 minutes.
yeah,
That
yeah,
means they rise your dopamine, and within 1.5 minutes, you or 1 minute, you need another shot of dopamine.
yeah,
And we
yeah,
used to watch Ramayana every week.
yeah,
We used
correct.
to wait on a Sunday that it will come. Our dopamine burst was that.
Yeah, yeah,
Or
yeah.
we used to wait for a cricket match in 3 months or 6 months. Now
Hmm.
every day there is 3 matches going on. So
Yeah,
it's a constant requirement of dopamine that is spoiling the entire generation. Once they don't get
yeah,
external validation, they want validation from people. Self-esteem is at an all-time low. I don't know. They have everything, but they think that they have nothing. So as long as we don't build on the self-esteem, as long as we don't make our kids resilient, as long as we don't teach them how to rise up when they fall, as long as we don't allow them to fall,
yeah, yeah,
the Gen Z will have a lot of issues. Like you told, they're facing a lot of problems. A lot of problems are because of the way they have been made to grow up.
yes, yes, I totally agree. It's an interplay. You cannot only blame them, it's the way we've raised them. So, what is happening in families, in societies,
Parenting.
colleges, everything, parenting, everybody has a part to play in this. And you can't only blame them. So, looking ahead, what systemic changes, whether we're talking about policy or we're talking about healthcare, education, would you like to see to make mental health care more accessible and effective?
Aninda or Amrit?
That obviously, sir, will say he is the policy maker for mental health care, anyways.
No, no, no.
He has been
It's,
changing the
I'll tell
landscape
you,
of mental health.
policies have been changed now. The Supreme Court has given a direction now
Right.
Yes.
for educational institutes. And I'll give you a very, very big example. Like my mom was asking me yesterday night while I was sleeping. This boy got 99.9 percentile in the NET the NET exam for the
Hmm.
undergraduate, and he committed suicide the day before he was about to join AIMS Gorakhpur.
Hmm.
He got AIMS Gorakhpur. He was about to join the day after, and then the suicide note he has written that I could have earned this much money by doing business. I never wanted to be a doctor. I did not want to do so much hard work so long. So he ended his life.
Hmm. Hmm.
No, no, no. I just want to tell you that somewhere or the other, we are failing our kids. We are looking at success only in terms of percentiles, money, house. We are not looking at a child who is smiling or happy as a successful child.
Hmm. Hmm. Hmm.
The parameters of success needs to be changed. The policy of just rewarding a few jobs with so much money and most of the jobs for so little money is creating a lot of havoc in our society.
Yeah, yeah, yeah.
If you look at a place like America, if you look at a place like Europe, you go anywhere except our subcontinent. Here, if you're good in MCQ and you have cracked a entrance exam, your life is a bed of roses, and you're not able to crack it, your life is a bed of thorns.
Hmm.
However hard you try, except for few businesses and few people who are very, very enterprising, you end up being at the lowest end of the cycle.
Hmm.
So we need to, not equalize, at least we need to raise, if somebody is getting 25,000 rupees per month and somebody is getting 2 lakh rupees per month, who cannot crack exam, which makes him get 2 lakh rupees or 1.5 lakhs per month, he thinks he's a failure.
Hmm. Hmm.
However hard he tries, however hard he works, he cannot make it up.
Right, right, right.
It's like the golden hour. If you can't get in at this time, if you can't do best in your plus two or your plus three,
Hmm.
your life, you become a clerk. You go down the society in terms of how much you earn, whom you marry, what is your acceptance in society, how you walk into a function. Everything is determined by only 1 or 2 exams.
Yeah, yeah, true.
Somewhere the reliance on the examination system needs, and And the examination system is only checking one aspect of you.
Yeah.
Even the most successful person is a depressed person.
Hmm.
He's not happy with his life. He's got the first rank, because he does not know what he wants. He thought that he's running after something which he does not know whether he wants it or does not. Because everybody is running, nobody is understanding where people are running. Just because 100 are running, I'll run after it.
Yeah. Yeah.
That's not we are just chasing something which will not give us happiness. So policies need to be changed. The exam systems need to be changed. The wage structures needs to be changed.
Right.
Everything, and the financial gain should be based on what you are doing, how much you are doing.
Right. Right.
Because 90% of the population is not working, 10% is only working. Even if you look at a organization you are running, you'll see that everybody is not working. Many of them are not working, and few people are covering up for most of the people.
Yeah. Yeah.
So work-based incentives, hour-based incentives are very important. We are only getting a position-based incentives.
Right. Right. True. True.
The parameters have to change. Mental health has to be taken care of.
Absolutely. Yeah. Yeah.
We need to understand that everybody who is running might have a pain in the leg. So everybody who is working, who is waking up and going to sleep might have mental health issue.
Yeah. Yeah. I agree.
Understand. We need to create teachers who are also. I tell everybody is a psychiatrist in this world. Everybody, including you. When somebody in your family comes little sad, are you not being able to talk to him for 10 minutes? If somebody you meet on the, having a cup of coffee, your best friend is going through a marital crisis, are you not able to counsel him? So everybody is a psychiatrist among us. The only thing is we need to make sure that we are giving the right advices.
Yeah. Yeah.
And
Right.
advices. That's very important. So everybody needs to be sensitized. Even our children need to be sensitized. I see a lot of young kids. I'm telling you, this is my experience. Many times I ask 7-year-old, 8-year-old kid, how is your mom? Is she better? Yes. Uncle, she's better. Doctor, she's better. Now she's shouting less. Now she's not fighting with dad. Now she's not accusing me, my father, of doing things. Kids also are telling. So if you think that kids are too naive, too young to understand, no, they are very, very sensitive. So somewhere the teaching has to come very early in our life, and policies, mental health has to be an important in the whole education system. I'm fighting now to include mental health, resilience, how to handle bullying, how to be happy in the education system. Hopefully, I'll be able to get in. I've been knocking on the doors for a long time now. So
All
if
the
you
best to you. I hope you're able to do it. Much required. Yes.
hope is what we'll live with.
Yes.
That's
No.
Ananda, you want to say something?
Yeah, definitely. Sir said very right. Like everybody can be a mental health support system, not a psychiatrist. Yeah, definitely can be a listening ear. As we say, we train the gatekeepers to question, persuade, and respond. Like they should be empathetically question what's happening wrong and then persuade the person to go for the right help. And definitely the stigma, it's like it should be leave no one behind, and the community health centers, the doctors in MBBS only, the training should change. I have worked in a primary health center for a few days just to manage my like own stress, like to be busy in my life. There I saw each and every medication of psychiatry was available, and they were disposing them off in the dustbins for like trucks and trucks of medicines were going in the dustbin because nobody was so sensitive to use it. And people used to tell me, madam, why are you wasting time by asking what's happening in your house, what's happening that, and you are already finishing for all psychiatry medications. So all psychiatry medications are available in the government setup also. It's approachable. It's just that one has to be sensitive enough to talk about the issue and to catch. So any MBBS doctors should also be trained to be sensitive to talk about psychiatry. And definitely schools are the first teachers, and they should definitely include the algebra, a square b square. I don't use now history, geography, but emotional regulation, if it was taught, it would have been much better in my life, much improved. Life skills, that is relationship skills, they are very important, and coping skills, resilience, they are very important to be taught to children. So definitely sir is knocking the door, so definitely door is open. I am 100% sure, not only hopeful. So things will change in the next years,
Right.
and mental health is definitely the utmost importance.
Yes.
And for the kids, like these days, it's Gen Z kids, they are like into digital comparison comes a lot,
Yeah.
and like screens they see, and but nobody knows behind that smiling face what's happening.
Yeah.
People put the most smiling faces on the social media, or and behind maybe they are crying or they are suffering.
Right.
So you don't know what's happening behind that smiling face, but the other person will definitely be thinking, oh my God, my life would have been much better. I have seen a real life example. My friend just put an example, like just put a photograph that I am in Bhutan. And I have gone to Bhutan with my on a solo trip, and my husband allowed. And another best friend, she actually fought with her husband that she has gone and you didn't take me. But she was not gone. Also, it was just a picture.
Hmm.
And there was a big fight. So it's like social comparison, digital comparison, which is happening and affecting the relationships. Then body comparison, fitting in the zero size, and all those comes.
Hmm.
And even social status, people see all the brands and everything that at our time we didn't even like have access to all this,
Yeah.
and we could not ask all these things. And yes, yeah, definitely there is a generation gap. Me at 40 years of age also feel a generation gap. Staying with my parents is very difficult.
Hmm.
So definitely Gen Z must be staying having difficulty with the parents, and there are issues. But they are also very stress is very like they are very isolated,
Hmm.
still connected but very isolated because of this whole ideal image they should maintain and hold the all the things, the pressure which is coming up, digital pressure. So that should be handled carefully, and parents should be empathetic. And definitely ranks don't define you. Ranks, money, education, nothing can define the character of the person. And many people, these Gen Z are much more creative than us, and they are much more intelligent, and they can do much better other in other fields. We knew only doctors and engineer, but now there are too many careers. So
Yeah.
that is much, it should be like wide range of options should be given to them, and parents should be open to that.
I agree. So we've connected today on the occasion of this very, very important day, which is the World Mental Health Day. So, very quickly on this occasion, what is one key message each of you would like to leave for our listeners or viewers about prioritizing their mental health?
Aninda, you'll take first or I'll take first?
You will take first, sir, obviously.
I'll just tell you that mental health is your own health.
Yeah.
If you think that somebody will understand it, somebody will take care of you, I think that's a little far-fetched. You need to take care of yourself. You need to understand when you're not at your 100%. You need to understand, are you overreacting? Are you overthinking? Are you doing something when you're stressed which you should not be doing? Are you better off doing what you are doing in terms every day? Please think,
Okay.
have great gratitude, be thankful. And I think if you really want to take care of yourself, you also need to take care of one person. So identify one person, try to take care of one individual. I think that will go a long way in taking care of yourself and the people around you.
Great.
Thank
Great.
you.
Okay. Yes,
So
Aninda.
that one individual, sir, can adopt me.
Yeah. See, Aninda?
Yeah, my message is mental health is not a luxury, it's a necessity. And you cannot pour from an empty cup. Until you take care of your own mental health, you cannot take care of anybody else. So, and talking about mental health is not a sign of weakness, and crying is not a sign of weakness. Embrace seeking professional help is important, and as uh, crucial as someone is seeking help for a heart attack or something. So, mental health is not a luxury, it's a necessity.
Right. Okay. So while we've come to the end of the conversation, we still have the rapid fire round, which is 5 quick questions, 5 quick answers. You don't get time to think. Okay. And I will decide the order in which you will answer. So the first one, are you ready? Yes?
I'm all ready.
Okay. The first question. One myth about mental health you'd like to bust in one sentence. Aninda.
That mental health is madness. It's
Okay.
crazy. Mental illness is madness.
All right. So Dr. Pattojoshi, what about you?
I tell you that all mental illness are not severe, are not serious, and don't require lifelong medications.
Okay. The next one. A simple daily habit you follow to protect your own mental well-being. Dr. Pattojoshi.
Eat well, exercise, and don't touch alcohol or cigarettes.
Okay. Aninda?
Talking to friends
All right.
and reading.
Yes, I'm sure that makes a difference.
Reading is one thing, then healing power of pen. Everybody cannot hold the sword, so pen is mightier than sword.
Yes, yes. The next one. If you had to describe mental health in one word, what would it be? Arinda.
Zindagi. It's
Okay.
like full zindagi. Yeah.
All right. What about you?
One word, yeah.
What about you, sir?
Me?
Yeah.
Yeah, mental health is a priority and is the most important thing.
Okay. Next one. One book, podcast, or resource you recommend to anyone who wants to better understand mental health. Sir, would you like to go first?
You can hear my podcast and my talks.
Great. All right. And Aninda, what will you say?
uh, Sir stops. Sir is my mentor and guide. And your podcast I love, yeah. Because it's the gender equality based. That is, I love that, yeah. And the elegance and grace you carry, I love that, yeah. I always say you are a real change maker.
Thank you. Thank you so much. And
Yeah.
finally, what gives you hope about the future of mental health, sir?
Post-COVID, I think there's a lot of awareness regarding mental health. I
Hmm.
think that's done a lot of harm, but that's also done a little bit of good in terms of people accepting mental illnesses as something that happens, that will happen, that
Yeah.
needs to be taken care of, that needs to be prioritized. And somewhere it has come to the top of this cycle that yes,
Right.
it's not, and with it, the importance of mental professionals also.
Okay. Ananda?
That we are now having leaders like sir which are changing the landscape of mental health, and definitely stigma is awareness is rising, and young generation is also participating, so mental health is becoming a priority, and community outreach activities, schools, and everyone is getting active.
Correct,
That
correct.
is the hopeful future, healthy beginning, so hopeful future.
Yes, you're right. I mean, there is the future definitely looks bright because we are on the right track. So, thank you so much. I must say, this has been one of the most, how should I say, enlightening conversations that I've had because you've shed light on so many things, which we as lay people just consider to be normal, which are actually not. We need to pay attention to them. Like you said, maybe talking about it, maybe writing about it, whatever it may be. There are so many things that, like I say, we normalize, which we should not. And I think all our viewers or our listeners who are going to go through this, who are going to listen to this, view this, will definitely, definitely benefit from this conversation. So thank you so much for sparing your valuable time and being on the show. Thank you.
As always, last
Thank you.
question,
Thank you
Sangeeta,
so
how do you
much.
take care of your mental wellness? You play so many roles, book launches and podcasting, teaching, academician, everything. Yeah. So how do you take care of your
I
mental
am
wellness?
like, I mean, I have a close circle of friends with whom I interact quite a lot and I read. Actually, I don't get a lot of time to just think because I'm always doing something or the other, and it all just fulfills me in different ways. So I guess that's how I deal with my life. So thank you once again for being on the show. Thank you for tuning in to the About Her show. If you enjoyed this episode, there's plenty more from where that came from. Our previous guests have shared some amazing stories, so be sure to catch up on past episodes. To keep up with our inspiring conversations and to never miss an update, hit subscribe, rate, review, and share the love. Follow us on social media for some great content, and don't forget to check out our website www.aboutherbysangeeta.com for stories that resonate, inspire, and empower. Know a remarkable woman or an inspiring man blazing a trail? We'd love to hear from you. Drop us a note at web.abouther@gmail.com and let's bring their story to life on the About Her show.